Hello, and welcome to 2019. Ask Me Anything. That's our motto for the year at Austin Dental Spa. Not that I'm going to have an answer that's acceptable for every question you ask, but we've realized there's a lot of information out there, and I'm trying to, on a week-to-week basis on these Wisdom Wednesdays, fill you in on things that you might not have known or even cared about prior to tuning in to Wisdom Wednesday. So thank you for being here this week, our first Wisdom Wednesday of 2019, because September 2nd I was still enjoying immensely being at the Sugar Bowl in New Orleans, because the University of Texas beat who was ranked like number 15 at that season-ending poll, beat the number 5 at the time team in the NCAA polls, University of Georgia. And I have some friends that went to University of Georgia, including one good friend of mine who's a dentist in Georgia and is a UGA fan. Sorry, Judd Connell, but I just talked to him on a conference call last night, and he did not really want to talk much about that game. But UT pulled through, turned away all the naysayers, and it was like an OU Texas game in October. Half the stadium was crimson and half the stadium was burnt orange, and of course, because it was New Orleans, it was crazy. It was rocking. Now Drew Brees is set to rock the house again in the Superdome in New Orleans, now called the Mercedes Superdome. But the Saints won last week, beat the Philadelphia Eagles, so they're playing for a chance to go to the Super Bowl. Nick Foles was a Westlake High School grad, and I watched him play some when he was in high school. He was also a tennis player when he wasn't training for football, and supposedly he's the only kid that Andy Roddick never beat when they were in the juniors. And Andy Roddick said, I played tennis all year round, and this kid only played when football was out of season, and I never could beat him because he was that big of a competitor. So anyway, good luck to Nick Foles this weekend, and congratulations, UT Longhorns, for ending the year on a positive note, and we're looking forward to next season already. So let's talk about a few things this month in Eastside Magazine. If you live on the east side, you've seen these around. They come as far west as North Lamar Boulevard, so you can get them at Whole Foods and at Central Market. They're free. Will and his wife that run this magazine are trying to run it like a Texas Monthly light, just about the east side, but they do a very high quality job. And there's our ad for this month. That's Kate, from the owner of Tomlinson's. She and her husband are 5th generation owners of Tomlinson's, and Dr. Jordan gave her a new smile about 2 years ago. But she's still lovely, and so if you get a chance to pick up Eastside Magazine, they got some great articles in there, and some great stuff about what's going on over on the east side. And so our health tip today, I'm going to go ahead and get that taken care of. It's this dreary kind of year where Austin's getting Seattle kind of weather. Vitamin K is well known. Vitamin D. Vitamin K is the one that coagulates your blood. Vitamin D is affected by sunlight. So if you're going through periods like we've been through in Austin the last couple of probably 2 months, where it's dark and cloudy and foggy like it was today, and there's not much sunlight, your vitamin D level can drop. In some people, not a big deal. In some people, it causes things like seasonal affective disorder, depression, insomnia. It affects your bones and your teeth. And so vitamin D is kind of an important thing. And if you're one of those people that has issues with that, then you might want to know ways that you can intentionally boost your vitamin D levels. Well, first of all, of course, you could take a vitamin D supplement. That's the quick and easy way to do it. But did you know that wild-caught salmon, not farm-raised, wild-caught salmon has 3 times the vitamin D levels in the salmon tissue than farm-raised salmon? Don't ask me why. I don't know that much about it, but I know that is a fact. Canned tuna is also high source of vitamin D. Fortified milk, if you can see on the outside, you get milk, which apparently nobody buys much of whole milk without anything added. They now have vitamin D, vitamin A, and vitamin C that can be added to milks. You just read across the label that they have milk that's fairly common that says vitamin D added. So that's an easy way to get it. Oysters. I did my share of oysters in New Orleans, and so I think I'm probably covered from vitamin D, which is good because it was rainy and cloudy the whole time we were in New Orleans at New Year's as well. Yet I didn't come back depressed at all, and probably more because of the burnt orange effect. And then the egg yolks are also a great source of vitamin D. I know egg yolks get knocked a lot in the health food circles that you should only eat egg whites, but the egg yolk has some pretty good proteins in it too, and it has vitamin D. So there's your quick, easy sources of vitamin D, and there's our health tip for the week. Eat more vitamin D to keep your vent levels up during this dark, cloudy, non-sunlight time of the year. Our health topic today, our scientific topic, is on a subject that's becoming more and more of a daily conversation here in the office. Xerostomia, or what you probably know more commonly by a dry mouth. Now, when I was in dental school in the late 70s, they said dry mouth pretty much only happens with people that are going through radiation therapy for oral cancer. And that's pretty much the whole thing they spent on us with xerostomia, was dealing with cancer patients and getting head and neck radiation. We know now, and I experience every day, and I've experienced personally 5 years ago, my primary care physician put me on a high blood pressure medication to lower my blood pressure because it runs in my family. All 3 of my brothers have high blood pressure. My dad had a heart attack when he was 62, survived it, but was on blood pressure medication and anti-cholesterol medication for the rest of his life. He lived to be 87. But he had dry mouth because I was his dentist for the last 30 years of his life once I got out of dental school. So these medications are another very, very common cause of xerostomia, particularly the antihypertensive or anti-high blood pressure medications and the anti-cholesterol or cholesterol-lowering medications. They are very, very commonly associated with dry mouth. Within 2 weeks of starting to take the beta blocker that they put me on 5 years ago, I noticed that my tongue would stick to the roof of my mouth during the day if I hadn't been drinking water. So now every morning I take a big tall glass of water back there and try to consume it throughout the day to keep my mouth wet. But that's the down and dirty, easy way, but it doesn't work for everybody because now there are a lot of other reasons, and they're claiming, the people that did this study, that 65% of the U.S. adult population will have an issue with xerostomia at some time during their adulthood, just because of all the other factors, not only medications and not only radiation, but autoimmune diseases, particularly Sjogren's disease. I've got several patients with Sjogren's disease where their eyes and their mouth dry out. They had to carry Visine around and put drops in their eyes continually because the saliva and the lacrimal ducts in their eyes don't create enough moisture to keep them done naturally. So they have to artificially keep their mouths wet and their eyes wet. And they also have numbness in their extremities, particularly fingers and toes. They get cold very easily. Diabetes is another main cause. They're claiming that in the next 10 years, 1 out of 4 Americans, that's 25% of the adult population in America, is going to be diabetic. Right now they're calling them pre-diabetic. But the studies they're doing and the numbers that they're indicating, 1 out of 4, 25% of the population is going to be diabetic, and that means they're going to be on medications like insulin, and diabetes by itself creates xerostomia or dry mouth. And of course, they always have to play the aging card. So it comes up in everything I read now. Oh, and aging. So now that I'm 65, I had to pay a lot more attention to that. But I'm finding that, you know, my body doesn't respond quite the same way it did 20 years ago. And so aging does play a part in your salivary glands. Things just kind of start not working as well as they used to. So, you know, those are the things we got to deal with. Now, what do you do about it? That's the big answer that everybody's looking for. Okay, we understand there are lots of different causes, but now I got it every once in a while. What do I do? Well, the simple one was drinking water. That's what I do. I still end up with it. I wake up in the middle of the night and it feels like my tongue would be permanently glued to the roof of my mouth, because if I've been laying on my back and breathing through my mouth, I've got xerostomia, at least in those situations. And so drinking water by itself doesn't take care of it. The next step that came out about 10 years ago, maybe 15 years ago in dentistry, was xylitol mints and xylitol sprays. Xylitol is an artificial sweetener that they've put in chewing gums now. All the sugar-free gums have xylitol in them. There are toothpastes that have xylitol. There are throat lozenges that have xylitol. You can find it all over the place. Over the counter, pretty good lubricant, but I also have plenty of patients that have tried the xylitol. It didn't work for them. Glycerin is a good one. You can get that over the counter in all the dental sections of the major pharmacies and Costco and Walmart and places like that. They have saliva substitutes that are a little spray thing that you can spray on the back of your tongue, and it's got glycerin, which is a real slimy substance. That works for some people. I've got plenty of patients at any given time, and that's what we have been recommending. But I've also know that one thing doesn't work for everybody, and a lot of people have tried these glycerin sprays and still have difficulty with swallowing, with their mouth, the dry mouth just continuing to get worse with time. So these people that did this studied a couple of hundred people over a year's time, and they tried all these different things, the xylitol, gum and mints, the glycerin, and they found that there is a, what did they call it? It is a lipid-based protein type formulation called oxidized glycerol triesters, or for short, OGTs. But 3M actually makes a spray for this. It's not over the counter. You had to get it from a dentist. I wasn't even aware of that until I read this article, which is why I wanted to share it with you. We're ordering some of this stuff so that we have it on hand for our dry mouth sufferers. But in this study, they found that everyone that tried it as a trial, and they didn't identify it, they just gave it to them, and they had placebo patients too, so that nobody knew exactly what they were getting. 100% of the people that tried this 3M xerostomia relief spray got relief. It lasts a long time. It's lipid-based. Lipid is a nice word for fat. Fats are lipids, and they don't get dissolved in water. You should know that you can drop fat into water. It's not water soluble, so which is a problem in your body with fat cells. But you can drink as much water as you want, and your fat cells are not going to be affected. But this lipid-based spray sits on your tongue, coats your tongue, and they say it lasts as much as 4 hours. So that's a significant advance from what we have had in the past in dentistry. So hopefully we will have this material in our office within the next week or two. So if you're suffering from dry mouth, give us a call. Let us know that you'd like us to inform you as soon as we get this stuff. You can be some of the first on the Austin market to have the 3M Xerostomia spray. For our first Wisdom Wednesday in 2019, welcome back, and we look forward to seeing you next week, and have a great 2019. So long for this week.